Good afternoon. You've joined us on Likeable Science. I'm your host, Ethan Allen. We're broadcasting live here from the ThinkTech studios in Pioneer Plaza. Thank you for joining us today. Likeable Science is all about making science accessible and fun and helping people understand that science is not something to be scared of, but it's something to be enjoyed and reveled in. Helping me to explore that topic today, I have two guests, Patricia Kiladis and Charlie Peterson. They're both with the nursing program at Chaminade University, and we're going to be talking today about that nursing program, about nursing in general, some of the challenges of nursing, some of the new emerging frontiers of nursing, and particularly how nursing education really works and how people are adjusting to this changing field. So let me do brief introductions here. Patricia Kiladis is the Interim Dean of Chaminade's nursing program right now, and came here a few years ago to really get that whole program up and running. Was the first faculty member hired for the nursing program. Really helped develop the whole syllabus, the whole course flow for it, and I guess has developed and taught courses also within that. Prior to coming to Chaminade, Trish was at Northeastern University in the undergraduate nursing program for a number of years, and has had a long and distinguished career in both academic and clinical settings, doing everything from working in neonatal ICUs and managing very complex systems there to teaching a broad array of courses. And she got her master's from Boston University in nursing, maternal and child health, and is currently a doctoral candidate at Northeastern University's Law and Policy Center, right? And Charlie Peterson here is also a nurse and has a master's in nursing with a specialist in simulation, and has been in the nursing field for several decades, I guess, since '84. And just recently received a Champion of Excellence Award from Education Management Solutions for her apparently groundbreaking work in simulation that we'll be talking about here. Yeah. Well, welcome both of you. It's very interesting to have you here, and I look forward to a good conversation. So maybe you can each tell me in turn a little more about sort of your role, and at the same time introduce the Chaminade's nursing program a little more here.
Okay, Chaminade's nursing program started 4 years ago. Well, it'll be 5 years now. We graduated our first class in May of 2014. The program began in order to meet the needs of the Hawaiian population. The Chaminade University of Honolulu was focused on the Hawaiian population and the Pacific Rim. So we really wanted to have a nursing program that reflected the diversity of the people, so that the people who are being taken care of in Hawaii are being taken care of in addition to other nurses, but also of nurses with Hawaiian cultural background or Hawaii Pacific background.
Excellent, excellent. And Charlie?
I pretty much teach the beginning classes as an assistant professor, and one of the things that reading over some of the information that we were going to share today, I think something that I think is unique about Chaminade is our service learning component. And I think it tends to enhance the learning that the students are able to do within what Professor Kiladis just talked about. I think we're very concerned about diversity and our students learning and enhancing their culture and learning about their culture. And so with our service learning component to our classes, they're able to do that. And I think that's very unique to our program.
Excellent, yeah, and there are these cultural issues in many of the Micronesian cultures. The gender roles are very set and very strictly defined. And of course, for somebody, say, from Chuuk to come to Hawaii for medical care and suddenly be confronted with the fact that a nurse of a different sex may be trying to treat them or something can be very unnerving, and add that on top of language barriers, and it can be quite, there's a huge need to enhance the diversity of the nursing workforce.
Yes, exactly.
Excellent. So we hear a lot these days about sort of the need for nurses, and without going into tremendous depth, and I understand it's a very complex issue, can you sort of give me a capsule summary of where, sort of why this is a critical growing field?
Okay. I think part of the issue we have to look back at is the recession that happened. And I don't think everyone calls it the Great Recession, but certainly it was a very large recession. And what happens during that time frame is nurses who have been at home or in other occupations often return to work, and that's both male and female. We're starting to see, whether or not the end of the recession, but we're starting to see changes. So what will happen then is the workforce, which is older, is going to start to retire, and we're going to see more of an influx of the younger nurses and the younger graduates. At the same time, we see an issue with the baby boomers who are going to be retiring. And again, the baby boomers tend to be a healthier population, but they're going to be needing nursing care, and they're going to need a lot more emphasis on prevention. And so both the American College of Nursing Association will see that by the year 2030, we are going to be in a large nursing deficit because of the various issues that confront us.
Huh. And certainly beyond the borders of Hawaii, certainly there's a huge nursing deficit out in the islands. It's simply a complete lack of trained healthcare workers in many of these areas.
Right, because obviously most of the islands, with the exception probably of the ones Maui and you know, the Big Island, don't have nursing programs. So if we start to get into Micronesia, you have you know, there are no nursing programs, and that's the same when we look at the world and look at underdeveloped countries. There is a lack of nursing programs. So again, you know, you see a forecast from a global point of view of you know, something like 4.3 million nurses are going to be needed, and there is a lack. You know, again, once you get into a global setting, there's different pay scales, there's different educational formats, and so that makes a huge difference in terms of who goes into nursing. But sort of getting back to Hawaii, or even the mainland in particular, if you live in a big city and you know, you just got out of nursing program with your baccalaureate degree, you know, you might head towards that hospital and say, I'm going to be a great inpatient nurse, I'm going to take care of, you know, a variety of populations. But the problem is that once we get into the rural areas, there is not the same amount of nurses. And so that's what we see in Hawaii, is that while in Honolulu we may have, you know, a good amount of nurses, or maybe a little bit more, once we move out into, even to Maui, to Kauai, to the other islands, that's not necessarily true. So we also see an aging population, and part of our program, we have an emphasis on gerontology because we really want people to get excited about the aging population who really need and demand, you know, a high level of health care. So from that perspective, we also see a tremendous growth for nurses in that area, as well as in public health and in the community. So it's not going to be just focused anymore on the inpatient and acute care, because that's not where our patients are. Our patients are in the hospital for, you know, sometimes 48, 24 hours, and they're in their homes and they're not well, and they're going to need nurses.
Yeah, and again, this gets sort of into the whole technology area too, because more and more people are having remote technologies that to some extent track them and allow them to stay out of a hospital and in their home, but they need to be monitored constantly by somebody, presumably a nurse, to keep track and be sure that the heart rate is staying at the right level, or that they are moving about in an appropriate level of activity, or not moving, as the case may be. Right, and I assume again this gets into some of the a bit more of the sort of the technology end of things. You have to train your nursing students to deal with these new kinds of technologies and learn to use them and use them correctly and effectively, right?
Well, some of the things that we want to do is make sure that the nurses that we're educating, there's a new skill set.
Right.
There's a definite need for nurses to understand mobility, communicating with other team members. We're no longer working just by ourselves. One of the things that has changed in education is we're a team now. We're a collaboration, whether it be a nurse doing telehealth or telemedicine. You're working with a team. You're not going to be on your own. And so I think it's important that our nurses be taught, or our students be taught, these different skill sets. and just being aware of all the emerging technologies. I think my philosophy as far as with simulation is teaching the student to adapt, because you can learn what's new this year, but I'll guarantee you it will change within 6 months to a year. There's so many new things coming out. So that ability for the student to learn adaptability, being able to work in a team setting, those become really important skill sets. And being mobile, Trish alluded to that. We're not going to be in an acute care setting totally. We're going to be all around giving care, providing care.
Right. So you've used now the term simulation a couple of times. Can you say a little more about what you do with simulation? I mean, it covers a lot of ground.
It does, and I think it's different for so many different people. Simulation basically has 3 components to it, and it basically is this prep work or this briefing that you give to somebody or a student. It can be an RN, it could be a student, it could be somebody that's recertifying for competency. But basically, you're giving them some sort of report, some sort of prep work so that they know what the scenario is about. They're going to go in and they're going to run some sort of scenario. And the last piece that is so important is the debriefing. And I want to really talk about, or what I really want people to understand, is simulation is a reflective practice. It isn't what you do when you're running the scenario. It's the reflection of what disconnects did I have. It is the only thing that I know within education that really covers the 3 domains of cognition, affective, which is your feeling, how you felt about what you were doing, and then that last thing is psychomotor. And so within simulation, we're giving students the opportunity to come in and practice, see how they do with those 3 learning domains. The big piece is reflection, and debriefing is the most important piece of it. If you just focus on what you did on the run and not reflect those areas that you need to improve, those things that you did well, those things that you have to improve, then it's not an effective practice.
Right. In that way, that's very parallel to education writ large, right? Where you must get students to stop periodically and reflect on what it is they've just learned, how did they learn it, what processes did they use to internalize that, and again, also allow them to actually practice that learning and do it. Yeah.
And I could interject here in that for people who really don't understand what simulation is, in terms of, I think you've explained it really well, but we have mannequins that we use. So we have different levels of mannequins, and we have mannequins that can, and they're voiced through nursing faculty. So the student would come in, they would understand a real nursing situation, but when they come in, instead of seeing a quote-unquote real patient, we have a patient that will complain and talk about all the issues that they're having. And we try and make things as real as possible in terms of, we may have get well cards, we may have some flowers there. We actually have a person at Chaminade who is an expert in, I think, making the patient have various wounds. We can also make them culturally appropriate. So it gives the student an opportunity to practice in a setting which is safe, where if unfortunately something untoward's happened, which does happen, in this debriefing session that Charlie is referring to, the student actually has that opportunity to look back and see, maybe if I hadn't done that, the patient would be doing a tad better right now. So
Yeah, we also look at the complexity. Because students are going to encounter complex patients, we're able, within simulation, we can take the scenario any way we want to take it. And so they're able to actually experience things that they may not see in their clinical setting. An example would be, we may have students who will spend all day with a birthing mother and never see that birth, where in our sim center we have a birthing simulator. And so for the orientation, every student gets to experience what the stations are, what they would experience. And so it's an opportunity for students to experience things and to get confidence, to raise their confidence in things that you don't really want them doing for the first time on a real person.
Excellent, excellent. Well, we're going to take a brief break now. I'm here, Ethan Allen, your host of Likeable Science, Charlie Peterson and Trish Kiladis from Chaminade University's nursing program. We'll be back shortly.
Hi, I'm Donna Blanchard, and I host the show Center Stage on the ThinkTech Hawaii digital series right here every Wednesday from 2 to 3 Hawaii time. I would really love to have you watch the show and see what we do here. I talk with some of the most amazing people, artists, most of them, all of them involved in some sort of artistic process. And our goal here on the show is to dig into that artistic process, and you would not believe what some people say, what some people do, what people go through to express. And these are people who have to express somehow, and I find that infinitely interesting. Not only that they have to express, but how they end up doing it. I really hope that you will watch the show and enjoy talking with some of these people the same way that I do. Thanks, and I hope to see you soon on Center Stage on the ThinkTech Hawaii digital series, Wednesdays from 2 to 3. See you soon.
And you're back on Likeable Science. I'm your host, Ethan Allen. With me here today in the ThinkTech studios are Trish Kiladis and Charlie Peterson, both of Chaminade University's nursing program. We're talking about the challenges and opportunities in nursing education today. And we were discussing just before the break a little bit about the use of simulation and some of the emerging technologies. So you can now have these patients who can be obnoxious, obstructionist, and basically create situations that you want. And perhaps it seems to me this opens up all kinds of excellent educational opportunities. If you have a student who is good with compliant people, for instance, give them a patient who isn't compliant and teach them how to deal with that. So that, again, as you say, they don't have to deal with this for the first time in a real life and death situation.
Right.
Excellent, excellent. So these simulation mannequins can sort of fake any sorts of conditions, so they can come in thinking they're going to be treating something relatively simple and easy and minor, and then the patient suddenly collapses from a heart attack or whatever. And
absolutely.
Yeah.
The students are always saying, I thought it was about this, and it went off on some tangent. And I had to dig deep and practice some of those skills or principles that maybe I didn't prep, or I didn't come into the simulation thinking. And I think that's like real life. Right. We talk about in debriefing how much you can get a narrow view of this is what, you know, from your report, this is what you think your patient's doing, but real life isn't that way. We have to constantly change. And that's the clinical decision model. Right. Being able to clinically think, pull all of the information that you have at your fingertips, that just-in-time learning or information, and then be able to make a clinical decision. And so it's part of our way within Chaminade's education to train the nursing student for lifelong learning.
Right, it seems to me to be a critical capacity in nurses, is to be able to think very broadly and to be able to sort of pull from very diverse aspects of their training. And so your whole nursing education program, I must assume, helps build these kind of capacities in the students.
Absolutely.
Excellent, excellent. So it seems to me this ties back to what we were referring to earlier, the changing roles of nursing. Nursing used to be something that was pretty much done in a hospital setting. And now nurses go everywhere, do everything. In some remote cases, they may be essentially primary care providers, basically, for some populations, right?
Right.
And that's a very different role than being an operating room assistant. Very different sets of responsibilities. So does your nursing program train those separately, or do you try to train people so they can come out and then specialize in any of these fields?
Well, the purpose really of an undergraduate education at the baccalaureate level is to really teach students in the broad perspective of nursing. So here in the United States, all students will experience in some way learning about pediatrics in the child, learning about maternity, as Charlie was just describing. We have a course called Medical Surgical Nursing, which has many titles, but basically covers a patient with different medical conditions versus surgical conditions. We usually always will have a more complex course on that area, which will delve into patients who may be in telemetry. Students will also learn about public health, community health, psych nursing, so what the role would be there, leadership management, and then generally many programs, ours in particular, will finish with an immersion course where the student will actually pick an area that they are interested in and work one-on-one with the nurse and practice as a nurse before they graduate. And I think most programs around the United States are very similar. Ours differs in the sense that we start the students as freshmen. So the students start as freshmen. They're admitted direct into the program. They don't have to wait 2 years. They don't have to go through 2 years of prerequisites and et cetera. They will be going through prerequisites, but they don't have to reapply for the program. So, but the idea would be, and I know for myself, and I don't know about for Charlie, but when I was a student, every single thing I got into I loved. Oh, I'm going to be a pediatric nurse. Oh, I'm going to be this. And then when you graduate, I ended up doing, I actually did end up in neurointensive care, neuro being, focused on the brain pathology. But I think the wonderful part about nursing is that you can do a lot of different things, and I have done a lot of different things, as you mentioned, over my career. Now, for both of us, we chose to then go into a master's program, and the master's program is where you make that specialization, you make your choice at that point in time. And then people can, when we talk about the advanced role of the nurse, generally we are referring to a nurse practitioner, but there's also a nurse anesthetist. So there's a wide variety of nursing roles that one might assume with a lot of autonomy, more interprofessional relationships. So as an example, you may have a nurse practitioner who works in OB/GYN, obstetrics and gynecology, working with an obstetrician. And a nurse midwife could do the same thing, depending upon the state and their ability to practice there. But what they would do there is work in collaboration with the physician, oftentimes seeing well patients, the more patients who don't have complicated histories. And they would work in a more of autonomous role. They would have the role of writing prescriptions for their patients, and only if there was a complication would the physician perhaps be involved. And so I think that's when we talk about the baby boomers and the need for the health care, that the collaboration between primary care physicians and nurse practitioners should be a wonderful fit, because the physician cannot, and I'm not sure they all agree all of the time with that, but it becomes a burdensome role to be able to capture all of that. So working in collaboration with a nurse with a specific set of skills, I think, would help.
Right, yes. It would seem, again, given the also projected doctor shortage, that this is going to become more and more necessary for nurses to be able to step up and take on broader and broader sort of chunks of the responsibility, so that for helping people maintain their own health care.
Right.
And it fits in well with our whole trend towards sort of personal responsibility, that people themselves are going to be taking more responsibility and not sort of deferring their health care off to their doctor or their nurse. So.
And the whole idea, I think it's what we call collaboration. Right. It isn't that the nurse is going to be in competition. The nurse is collaborating with the physician, whoever that physician may be, in terms of providing the high quality of health care that's required. And I do think your idea about, we call it the engaged patient. So the patient who would come in and say to the physician, just do what you want and don't tell me anything, they need to take personal responsibility for their own health care.
Right, right. So there's a whole education role within the nurse's job now to help patients learn to take on that role, learn about what healthful diet, healthful exercise habits, whatever, to help keep them essentially to sort of work themselves out of a job, as it were, in a sense, right? Excellent. Well, that's great. So, tell me a little bit more about Chaminade's program. You just had your first class graduate, and where are some of your nurses headed off to what sorts of things at this point, or do you not know this yet?
Well, they just graduated.
They're busy.
So yes, and I think we have one nurse who, one of our students who actually went to Chuk on a clinical immersion. And, you know, she's one of our top students, and but she didn't know what she wanted to do. She just said, and she really thought she wanted to work with different populations, but while she was in Shook, she had the opportunity to work in the operating room, which we don't have as a clinical specialty, many universities don't. And she fell in love with perioperative nursing and is now taken a job in perioperative nursing. So I think for some of the students, they're still trying to pass their state board examination, and then as they pass that, they will then, you know, make that decision about what possible job. A lot of them actually in their clinical immersion last spring were able to make connections, network with people, and have will be taking positions related to some of the places that they were working here in Hawaii.
Right, that's a very interesting sort of apprenticeship model that you're using, then, to have them go out on the job and follow along and do some of the work while they're still students before they're formally, I guess, credentialed, as it were. But undoubtedly a valuable one, and really it harks back again to a very old educational model, right? That's sort of how you best learn, is by getting out there and actually doing things. And again, a great way to find out, I would think, for students that they do or don't like a particular area without having to invest a huge amount of time and energy in it. If they find that, yes, they're working with an operating room nurse and they find they can't stand the sight of blood, for instance, this is a good time to learn it, rather than investing a few more years finding that out. So,
well, they do start. Sorry, Ethan. They, you know, and we start, you know, incorporating simulation. But all students will, as a student, be with a clinical faculty, usually with a very small ratio of students to faculty, and they actually practice throughout the program. And this is pretty similar throughout the country. In a clinical area, all, as I mentioned before. But the clinical immersion does differ. The clinical immersion, at that point in time, they actually are not assisting anymore. They're not just following directions. They're actually assuming the role that they will then be licensed to do. So they will have their own set of patients, be responsible for their own set of patients, their own medications. So they actually go through the role. So
very, very interesting. And again, it seems to me that, getting back to the simulation idea, this is great because it gives your program a chance to expose the students, to guarantee that every student can see certain kinds of issues before they get out.
I don't know. I mean, I don't have a vast knowledge of what other schools are doing. I mean, I go to conferences and that sort of thing, but I really do believe we start our students very early. We start them in simulation their second semester of their second year. And so they're in simulation. Of course they're doing skills labs, of course they're seeing task trainers and that sort of thing, but they're actually doing simulation at a very early time in their foundational knowledge. And we're seeing great outcomes. We're just seeing really good results, and they like it. I think that one of the things I wanted to share about Chaminade is the fact that we're so student-centered. I think every student has the opportunity to just have their learning really focused on how they learn best, and also using these engaging activities such as simulation. So we really do see really good outcomes, and our students are very happy with their education, I think.
That's absolutely critical. I mean, if the students aren't engaged, you've sort of lost that whole battle. Well, this is great. We're having a good conversation here. You're with us on Likeable Science. I'm having a wonderful dialogue here with Charlie Peterson and Patricia Kiladis from Chaminade University's nursing program. We're going to take a brief break, but we'll be right back.
Hello, I'm Martin Despang, and I'm the host together with the one and only Ali Amashta, and our show is called Urban Transcendence. And Urban Transcendence is about identifying where we have a unique situation of a vibrant city in one of the most beautiful natural environments. So how these two can coincide, sometimes conflict, how they could find reciprocity in the 21st century is what we're excited about. And we're planning on bringing in a diverse body of guests, both from the arts and the science and the established and the wise and the emerging generation. So hope you will join us. We'll always be on Thursdays from 1 to 2 p.m. Thank you.
And you're back on Likeable Science with your host, Ethan Allen, that's me. And my guests today, Patricia Kiladis and Charlie Peterson from Chaminade University's nursing program. We're talking about some of the frontiers of nursing and the challenges of nursing education. And I wanted to get back to an issue that you brought up earlier about, Charlie, you brought up about the rapidly changing technologies. And certainly that's got to be a huge issue. There's new medical tests, but beyond that, there's new diseases popping up all the time. There's outbreaks, there are things that haven't been seen before. And so it seems to me it's a very complex milieu for training your students.
Well, and the one thing, that we tell the students is don't forget that you're going to walk into a room or walk into a home, and that patient's going to know more about their disease process than you do because of the internet, because of, I'm not sure of the percentage, but so many people are getting their health information off the internet. So that brings challenges to the practicing nurse, being up on, and again, going back to teaching that you want to be able to know your resources, and we call it information literacy. Being able to know what's good information, how to find good information, and teaching students how to be able to find those resources themselves.
Right.
So I think lifelong learning, we're mandated as educators to do that.
Right, but there's sort of it's a two-edged sword, right? Your patients may know a whole lot more and be more engaged, which is all probably good, except some of them probably know the wrong things, right?
Right.
That's the challenge.
And are very convinced of the rightness of their knowledge while it's dead wrong.
Right.
So that's teaching your students to deal with that must be, I suspect, certainly a challenge too.
Yes. Well, I used to teach, when I first came here, I've been teaching pathophysiology and pharmacology as a combined course. And so, particularly with pharmacology, one of the things that I have them do is to search the internet as a group and come up with, let's talk about, gastric distress. And your patient has it, what drugs are you going to use, and what are the most common sites? So I have them look, and then we talk about what sites they may have found, what information is there, what misinformation may be there. So that's another piece of it. You're right, absolutely, that patients do get a lot of incorrect information because they don't know how to search the internet. They think they do, they press some buttons. Right. So it's learning, teaching, and I think that's another piece that we have to do is being able to give our patients what are good sources, the Mayo Clinic as an example, versus Wikipedia. Yeah. I like Wikipedia for certain things. I don't want to badmouth them, but I think that's sometimes where our patients are getting information, and that even Wikipedia will say we're not always correct, and we understand that.
Right. Yeah, and at the same time, there are, for example, there are new designer drugs that have ill effects that people are, probably 3 years ago, this wasn't even an issue. The thing didn't even exist, and now patients are suffering ill effects, and your nurses have to learn about this, learn how people are using it, what the impacts are, how to treat it. Yeah, so that's got to be. So how do you sort of, what do you do to keep up to date with all this kind of stuff? I mean.
Well, I think you have to be careful though, because I think as nursing educators, we would probably like to teach everything that's in this book that's this big, and I think it's recognizing that it's impossible. It's like for me to say pharmacology, okay, in this course you're going to learn all the drugs and you're going to memorize them all. So it's really, I think as Charlie was saying, it's lifelong learning, but it's also trying to adapt a conceptual framework, is that understanding, I know this piece of information. I know that patients will have problems with as an example, air diffusion. So what would all be the categories, but understanding the mechanics of how, what could happen to interrupt the movement of air in and out. So rather than looking at from a disease point of view or a systems point of view, we're starting to look more at a global and trying to help students more recognize their learning needs and how to learn the information than just giving them everything, because there isn't any way that in any course we can present all the material. So how do you help students develop critical thinking skills where they can start to take a concept and then work through the concept because as they graduate, that's what they're going to have to
Yeah.
do. Certainly as generalists in nursing, there isn't any way you're going to know all that information any more than a physician does, or anyone else who's in the healthcare. So I think it's, what are your resources? But it is a challenge because, as you say, just when you get one disease down, a new one pops up, and
This recent Ebola outbreak in Africa
Yes.
that's doing nothing but growing over recent weeks and months. There must be huge nursing challenges with that.
Well, medicine just changes.
Right.
And I think medicine is change, and healthcare is change. And look at all, I was looking, doing some literature searches, and I was looking back, I don't know that I want to see anything or look at anything 2010 anymore. I'm looking more for 2012, 2013, because our healthcare, just our delivery system has changed so much. And so it's an example of how we just constantly have to be able to sift through all of this changing information. And I'm not quite sure we know what healthcare is going to look like in, say, 5 years.
Right. No, I would say we don't probably, but we can make some guesses of some of the directions it's going to head. And these new monitoring technologies, with sort of the whole smart home idea,
Right.
that are really going to profoundly alter how particularly care of the older population is being dealt with. When you'll be able to sit at a console basically and monitor a number of different people spread around across the city or across the world, for that matter, in their homes, be able to tell what they're doing, what they're experiencing, when they last ate a meal, have they done this, that, or the other thing?
Well, I'm not sure if 10 years ago we were even where we are today with telehealth and telemedicine.
Yes.
Right.
And those strides are unbelievable, that people can be in their home, they can be in a rural setting, they could be in another country,
Right.
and they can have access to health care, which is just amazing. With that comes the challenges. And I think it just goes to the whole theme of what we've talked about, making sure that the students that we graduate from our program understand adaptability. You have to be able to deal with change. You have to be able to critically think
Right.
through all of that's going on.
Some of the there are new both apps and devices to stick on your iPhone,
Right.
your smartphone, to make it into a very powerful clinical tool
Oh,
that can do all kinds of interesting stuff.
Yep.
And that can, of course, whisk that information off to anyone, anywhere in the world that you. Yeah.
I think our technology is way ahead of where we are as far as security and confidentiality. And I think
Yeah, absolutely.
what's happening, or at least it's my opinion, what's happening is we're slowing down just a little bit because we have to have those two entities catch up. Technology-wise, we can, it's unbelievable. You could turn your smartphone into an ultrasound and be anywhere. But how do we deal with that information? And so those are things that I think will pan out over the next 4 or 5 years. I think we'll have answers to that.
Yeah, it's again got to be some of the challenges we face. So what else, sort of stepping back and looking a little bit bigger picture? What does sort of Chaminade see as their big challenges for the nursing program?
I think, at this point in time, as we said, we've just graduated our first class, so we're going to be looking back at the curriculum and how, that has impacted the student, and so moving forward, how do we change the curriculum again to meet the needs of the students, but at the same time keeping the important and critical points of the curriculum. Challenges, again, are around the domains of knowledge, and how do we teach, because each time there's new pedagogy that comes along. The new buzzwords are flipping the classroom, which is putting the responsibility onto the student for their learning, and does that, again, we have to look at the effectiveness of that type of teaching and whether or not, for the student who has to take a state exam, a national exam, and answer very specific questions, is that effective? We have a very diverse student body, which is very important for our population, but diversity also brings challenges, and making sure that academically our students meet the requirements and the challenges ahead. Maybe you could add?
Well, I think one of the things that was eye-opening to me is that I think the national average for male nursing students is 8 or 9%, and we're somewhere, I want to say 20%.
25% we have male students, so that's, yes.
And so that can be a challenge. Not that it's a bad challenge.
Right.
You have to look at how you've been teaching nursing students in the past, and is that going to meet the needs of the male student?
Mm-hmm.
And we need to adapt to that.
Right.
And so some of those things have kind of come up over the last 4 years, and I think those things are exciting because the role of the nurse is changing.
Right, and particularly again in these multicultural contexts where there's expectations on the part of your patients that they will or will not be treated by a male or a female nurse.
Yeah.
You really need to have that kind of option to be able to give them to provide the treatment that patients may need. You can't do it any other way. So this is sort of a loaded question maybe, but oops. So how do you measure the success of your program?
Well, I think again we could just say anecdotal. Our students, give us information back. Generally, success in many nursing programs is measured by success on the NCLEX, so that ability to pass that examination. However, that only captures one piece of it, and it really doesn't capture the skill set of the student. The student, there's many other talents that the student has other than the ability to pass that exam. However, that certainly, is one of the key factors that we look at, but we also look at outcome data where students are being, placed in different jobs, student satisfaction with the program. So we will be evaluating, we evaluate that at the end of the program, and then we will evaluate it a year out. So to find out, what does a student now, because when you first graduate, you don't really have, I don't want to say a clue, but you don't really know what you know in terms of where you're going to be practicing and how your program has been successful for you. So I think it's the student through that first year as a graduate nurse then recognizes, oh my gosh, that pathophysiology course, not to spend time on that one, was very important. And yes.
Indeed, probably 5 years out, it'd be good to go back to this first class and ask them and each
Which
subsequent class.
We will.
Right,
so we do alumni surveys, and we will be going out. And we look at different measurements. So at that point in time, we're no longer concerned about, the NCLEX, which is the national licensure exam, because they've passed it. So now let's look at how did simulation, how was simulation, how did that help you in your nursing career, how it didn't help you, because we are going to be getting the end, there's a report coming out now on a national survey that was done on simulation, so we're going to be getting a lot more information in the fall related to that, but not from our students necessarily, but in general.
Right. But this gets back then to what you were saying, Charlie, about the reflective aspect of learning is, as a program, to be able to reflect back on your program and to get the students' reflections a year out, 5 years out, to really help you keep everything fine-tuned and adjusted to meet the current needs.
Absolutely,
It's going to be absolutely critical. Well, it sounds like there's a very exciting sort of set of challenges you have lining up for you, but it certainly seems like you're working on a really absolutely vital piece of healthcare here, in the sense that we all know, yes, we all are aging, and sooner or later we're going to need care. There are huge populations, I know, in the not so much here in Hawaii, but in the Pacific Islands, who are vastly underserved. And again, Chaminade's commitment to bring some of those students into the nursing workforce and providing Pacific Islanders who are then trained, qualified nurses is certainly admirable and much needed. So that's all great. Well, this has been absolutely wonderful. It's been a wonderful conversation here, and I've certainly enjoyed having both of you here. Any quick last thoughts here before we jump out?
No, we really thank you, Ethan, for having us come. Enjoyable. Yes, very nice, and thank you.
Okay. Well, you've been joining us on Likeable Science here. My guests today have been Patricia Kiladis and Charlie Peterson, both from the nursing program at Chaminade University of Honolulu here. And we've been discussing the challenges of nursing education and how it's a changing field, and they've been telling me about the wonderful things Chaminade is doing, and I thank you very much. Aloha.
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 And mahalo.